At the Fixell Institute, we are so thankful for caregivers. We know that brain diseases affect a particular person, but brain diseases are a lot more than just one person. They really affect everyone in that person's life, especially the caregiver. We also know that people with brain diseases need a team. And while here at Fixell we are members of that team, as physicians, advanced practice providers, therapists, social workers, dietitians, the caregivers are really the most important person on the team. And so we are thankful for you and all that you do. We know that the lives of the patients we serve would not be the same without you. You are so instrumental in helping the quality of life of every person who comes to our center. We also know that you need to take care of yourself. So we know that caregivers who take time for themselves are better caregivers. And this isn't selfish. This isn't about you. This is really about taking good care of the person with the brain disease. So you can't support them and help them and feed into them unless you have something in your tank too. We also know that caregivers who get breaks are more caring and can give more and have more of a reserve. So in this Caregiver Appreciation Month, one thing we want to encourage you to do is make sure you're getting those breaks. Sometimes I'll even write a prescription and say, take 1 half day off a week. And when I say take a half day off a week, I don't mean clean your house or get the oil changed or get groceries, but really take some time for yourself. This is a little harder in COVID, there's no doubt about it, but go to the library or get a coffee or take a walk, see a friend, do something that recharges for you. And when you're recharging yourself, know that you're also doing it for your loved one, because you will be a better caregiver if you have something in your tank. It's not selfish, it's critical for you and for them. And let's be honest, often they could do with a little break from you as well. So in this Caregiver Appreciation Month, I want to thank you. I want to acknowledge that you are the most important person for the patients that we take care of. I want to tell you that you have a hard job and it is wearing, and there are going to be good days and bad days, and you're going to wonder if you're doing things the right way. But know that we see you and we appreciate you. We want to support you, and what you do is amazing. So thank you on behalf of our team and also on behalf of the people you help.
I want to reach out and just give an absolutely warm welcome and thank you to all of our caregivers for Parkinson's disease and Parkinsonisms. You all are just amazing. And we know from research that it is the caregiver or the care partner that is possibly the most important factor to the success of someone living with Parkinson's disease. So there's nothing that we can do more than to honor you. And one of the things that surprises our students and our residents and our fellows in training is every time I go in a room, I think it's important to address the caregivers and the care partners and make sure that we are paying attention to them. And in many cases, we should be spending as many minutes taking care of our caregivers and care partners as we do the individual persons with Parkinson's disease and movement disorders. It is so, so important. And the caregivers and the care partners at our place, the Norman Fixell Institute for Neurological Diseases, we consider you part of the team. The person with Parkinson is the sun, okay? And we should orbit around that person. And part of the orbit around that person is the care partner. So you're really on our team. And we know that the attributes of successful caregivers, they go well beyond just the dedication and the perseverance. They go to people that are organized. They are, advocates. They advocate. They bring things to people's attention. They get things done. But more than anything, they're so good at creating and executing a plan to allow the persons with Parkinson to have a successful and meaningful life. And we've seen the efforts of caregivers and care partners to contribute to the quality of life for Parkinson's disease. And these efforts are to go above and beyond. It's not just medications. It's not just setting up appointments. It's not just being the driver. It's not just organizing, itineraries. It's being there for the social support to make sure that the mood is good, that people are able to interact with their environment, and you're able to find the core goodness, the core happiness, and the ability to lead a happy life despite a chronic degenerative disease. The advice that I have for caregivers as they continue to manage the challenges of living well with Parkinson's disease, ask for help. Your teams that are around you, we're here to help. Reach out. And too many times, you're taking it all on your own. And when you feel like there's just not enough time and you're saying to yourself, I don't have enough time to meet, I don't have time to do this, I'm stressed, call a timeout. Just call a timeout. Bring in the care team around and we can help. And so we consider you part of that team that orbits the person with Parkinson. You're awesome. You are the one that ensures good outcomes and positive and meaningful lives. So we salute you as caregivers and as care partners, and we thank you for all that you do to help all of us in the management of Parkinson, but also to make sure that your loved one has the most meaningful and successful and really well-lived life. So thank you very much.
Hi. I just want to say thank you and we appreciate you. The caregiver, you're the most important part of our FixL team. You're the eyes and the ears that we need to know what is the best plan of action for your loved one. It's the roles that you play. You, not only are you a husband or a wife, but you're also a caregiver. And it's the balance between those two that makes the most successful caregiver. You need to be organized, but flexible, and to be kind to yourself. And something else that I wanted to share also is that we need you to take care of yourself. Make sure you are realistic with your goals, but also have the right support for you, because we need you. And guess what? Even though it's a thankless job sometimes, it means the world to your loved one that you selflessly have worked so hard for them because you love them and they feel like they are worth that. And that is the most important thing that we can't give them, but only you can. So thank you and keep doing your best.
Hi, I'm Melissa Himes. I'm the clinical manager for the FixL Institute.
Hi, I'm Jessica Turkso. I'm the lead nurse for the FixL Institute.
And today we're going to discuss how important caregivers are for our everyday routine. Caregivers are important for providing these services at home when we are not present. Caregivers are the sponge that take in the valuable information for our patients.
Caregivers for us are a key component for keeping things organized. They communicate patients' wants and needs, and they keep things on track. Caregivers, they are the puzzle piece between our clinic and home.
We could not function without our caregivers.
Thank you, caregivers.
Thank you.
Say thank you to our caregivers who come to our sessions and therapy. We really appreciate you. We can't do it without you. You guys are amazing and really help us sink in the education and give us the tips that we need for all of the day-to-day activities and things that our patients can't remember, or maybe their memories are not quite as good as yours. We appreciate you and we appreciate your support in our sessions, and just thank you for being there.
Hey, thank you for your love and support, and keep one thing in mind: PMA, positive mental attitude.
Thank you, caregivers.
Thank you for all you do.
Thank you.
Thank you, caregivers, for all that you guys have done. We always appreciate you and we wish you the best.
Thank you.
Thank you, all you caregivers out there.
Thank you.
Thank you, caregivers. Thank you for all that you do.
Thank you.
Thank you.
Thank you for all that you do.
Thank you.
Thank you for all that you do.
Thank you.
Caregivers, we value the love you give, the time you spend, the sacrifices you have made during this Parkinson's journey. And we want to thank you for allowing us to be part of your team and a part of your family.